Right. Hi, everyone. So, as I promised, today we have FMG. Basically, she's my senior.
Mhm.
More than a senior, she's more like my sister. And because of this reason, now we are now we are like okay, we are face to face again. So let me introduce you to my lovely, lovely, lovely Dr. Chandni. Hi, how are you?
So I'm good. How are you?
All good, all fine. Can you just give us a brief introduction of yours?
Okay, so I'm Chandani. I did my undergraduation in Russia, then I studied for a bit in India, and then now I'm working in the UK, in the NHS as a doctor.
Wow. So, let me ask you this question that was there any moment in your life when actually you decided that you want to become
Mhm.
a doctor? Was there any such moment in your school time or
There
something?
was, yeah, there was a moment when I was 5 years old
Uh-huh.
that I thought that I wanted to be a doctor. So since that time, I actually mentioned it to my mom, and then my mom was very happy, of course. But
Right.
also, at the same time, it was about like she's like, "Do you want to do something else? Do you want to be creative?" But I'm like, "No, I want to be a doctor." So yeah, since that time, and it kept solidifying that wish to be a doctor. It kept solidifying over the period
Wow.
of time.
Wow, like it's quite a
Yeah,
young age you decided that. I mean, I don't think
yeah,
when I was 5 years
yeah,
old, I was even aware about this, okay, what this profession is all about, right? So, like,
yeah,
okay, it
yeah.
was your
Yeah.
childhood, we can say it was your childhood dream, right?
Yeah, it's like because I like taking care of people, and so I kind of wanted to put an academic thing to it to look after them. Yeah.
Perfect, perfect. So, as we know that we
Yeah.
have graduated from
Mhm.
the same university, so let me ask you, how was your experience being a medico abroad?
It was so it gets a little bit, it's a little bit tough because we come from different systems. So
Mm-hmm,
you need to give yourself that time to get used to the NHS. But of course, the basic medicine remains the same, like taking a history, presenting that history, making decisions based on what your clinical diagnosis is of the patient. But
mm-hmm,
of course, because we come like India and the NHS in the UK are quite different. So you give yourself 6 months to 8 months to get used to it
mm-hmm,
and know that it's going to be a different thing, but you need to be a team player. So that's a bit of a challenge. And I think most people, they get scared of that challenge in the beginning, and they feel that it probably would be very easy over, but it is different, and you need to accept that and then like
mm-hmm.
move on with that and continue your day.
Mm-hmm.
Mhm.
So
Yeah.
when you entered St. Petersburg,
Mm.
right? So it was completely, there was
Yeah.
homesickness and
Mhm.
everything was there. New people were around. We had to learn
Yeah. Yeah.
language. There were not only one challenge, I feel,
Yeah.
there were many challenges. So would you like to
Mm.
share like how you overcame
Yeah.
all those challenges and how you were, just still stick to your dream and your passion?
Okay, so when the first year was very challenging for me in Petersburg
Mm-hmm.
because I didn't know how to cook. It was very cold. I didn't know what to wear at what time because it suddenly used to become cold, suddenly used to become hot, and then at the same time you realize that you are in a country that actually doesn't speak English.
Mm-hmm.
And then it did become very, very challenging. And at the end of it, but what happened is that some cities happen um in at the end of it, I felt that if I went home right now, all my like I would have to repeat my first year. I'd waste time. And then will I be a doctor? Will I be able to get into a field in India or the medical field in India or some other country? So keeping all that in mind, I said, okay, this country, whatever it is, whatever the challenges are, it is helping me to achieve my dream. So let me just go through it with resilience and take it one day at a time. Yeah.
Right.
Mhm.
So, as we all were
Mhm.
aware, I don't know in early years of our graduation, but we all were aware, right, that after coming back to India, if we are willing to, practice as a clinician, we need to
Yeah.
go through with
Yeah.
MCA. So, it'll
Yeah.
be really great if you could share some strategy of yours and, when have you started, when have you realized that, okay, I need to start prepare for this exam, basically, seriously.
Mm. Yeah, so I think if you are consistent throughout your 6 years in Russia and you're able to um like go through your all your classes and everything very well and go through the exams very well, then I don't think the MCI should be a problem. I think I mean there are different questions and there are different things, and you can join those classes, which I joined after coming back from Russia. But the
Mm-hmm.
clinical knowledge is kind of the same and it's consistent. It's the other things that you kind of have to learn, which those classes teach you and guide you according to that.
Mm-hmm.
But if you do not pay attention in those 6 years and you Skype off your lessons or you don't go for classes properly or you don't make those notes properly, it's very difficult because you can't do 6 years worth of medicine in 1 month or 2 months. So
Mm-hmm.
it's just that I would say consistency throughout the 6 years. And then at the end of it, or if you go back every year, I think if I could do something differently is I would go back every year and just join those classes,
Mm-hmm.
either every year or from third year onwards, join those classes that are in Gautam Nagar, and just go through their notes. So that would help, I think, a lot. If there's something I could do different, that's the thing I would have done. Yeah.
Okay.
Mhm.
So, right, in your first year itself, you start to prepare. You start to taking this exam quite seriously. Yeah.
Yeah, 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 yeah.
Right.
Mhm.
And your strategy was to
Yes.
go along with the syllabus and the curriculum the university is providing. Yes.
Yeah.
And it
Yes,
actually
yes,
helped
yeah.
you. And what I remember, yes, you cracked your MCI in first attempt itself. Yes.
Yes, yes, yes. Yeah.
So,
So that along with the classes in Gautam Nagar, those 2.5 months, I left everything else and just concentrated on what they were teaching, going through their lessons again and again. And then I think that's how most of us were able to clear
right. So,
that.
how was your
Yeah.
experience in
Mhm.
Gautam Nagar basically?
It was okay. It was a bit of a culture shock. I think all of us would say that who've studied in Russia, we get used to a certain way of life, and then when you come back to India, it's like there's a different culture, there's different difference of climate and everything. But then you get used to it. It's all right. Yeah,
It's all right.
it's
It's
nothing
nothing like
major.
impossible. Yeah, nothing major.
Yeah, within 1 week you're fine. You're okay. You're back to your country, and it's fine. But it takes a
Yeah.
little while to get used to that. Yeah.
Right. So,
I
how
think
was
the only challenge was you know that you're not going to go to Russia and you're not going to be with the same people that you were. So that is the main memory that you're leaving, and that's what's causing the sadness. Yeah.
sadness? Yeah.
Mhm.
So, how you managed with
Mhm.
it? You still were like, okay, you were a very practical person, I know. And you were like, okay, I have to be
Yeah.
here just to, move, enhance my career. Yeah, we
Mm.
need to do it. So, I think that's a click. Everybody
Yeah.
needs to realize that, it needs to be done. Either you want to do
Yeah.
it, or either you
Yeah.
don't want to do it.
Yeah. Exactly.
Right.
Yeah, yeah, that's right. Because in that present moment is what you have, because those past is not going to come back. Even if you go back to Russia, you're not going to have the same people. You're not going
No.
to have the same this thing. So it's not going to be the same. So have the memories, cherish them, but move on. You have to move on.
Move
Yeah.
on. Yes, you have to move
Mm.
on.
Yes.
So
Yeah. Yeah.
since like after coming back to India, you worked in India. I remember in Pune. Yes.
Yeah. Yes. Yes. I
So
worked in Pune in Jahangir Hospital. Yeah.
right. So how was your experience in like after coming back from Russian medical system and jumping into Indian medical system? How was your experience?
So it was very, very challenging for sure. But also, just to let you know that I first started internship and then I did a month, and then the second month I was in another department that was obs and gynae, and I couldn't take the culture change, the work culture, because in when you are in Russia, you get used to this thing where everyone talks to you with respect. They're not unnecessarily angry at you, they're
Yes.
not unnecessarily putting you down.
Yes.
But then that happened and I couldn't take it. So I had to take a break. So I took an 8 month break from all of that. And then I came and I did meditation courses and stuff which calmed me down. And
Okay.
then I came back and then did my internship properly. But yes, I did take a break from internship because it was causing me mental stress, which it does happen. But what you need to know again is that you need to do the internship in order to get the license, in order to get other things in life. So you just have to do it. Just something you need to do.
Just accept it. I mean, the acceptance
Just
is
accept, like
good.
find ways. yeah, find ways that you can go through it, like find a friend you can vent off to, or a family member, or meditation, or some kind of way that you can keep your mental peace
Mhm.
whilst you do all of this, because you need to know there is an end to it, and then like life gets better. So you
Yeah.
just need to go through that. Yeah.
Right. So, right, like in academy, in while you were undergraduating, right? So that time itself, you decided that you'll be advancing your career further in UK, or you had some other plans.
No, so I at that time, when I was in when I finished my thing in Russia, I wanted to go to USA,
Mm-hmm.
and I wanted to get my USMLEs, but of course that did not happen at that time because of certain things, certain family issues and things. So I did not study that well for the USMLE, and
Okay.
I didn't end up giving USMLE. Or no, sorry, I gave an attempt and I didn't get very good scores. So like you need better scores to do that, and the market was very saturated that time in USA. So as a backup plan, I thought let me just start working,
Mm-hmm.
because after internship I didn't work for 6 months and I felt my clinical knowledge was evaporating. So let me just start working and then figure it out from there. I'll at least start earning some income. I'll get some kind of confidence. So I started working in the emergency department, and then my mentor, Dr. Fias Pasha, who is not there anymore, he's gone to heaven. Sorry about that. So he's the one who had done MRChem in the UK. And then he encouraged me that this is a field and you can actually advance your career in the UK through this path. So that's how I came to know about it. And then now I'm here. Yeah. Mhm.
Like you started preparing, like after your internship, you took like within a year. I mean, after during the internship, you realized that okay, fine, you want to
Yeah.
go ahead in with
Yeah.
UK, right? So, how was your
Yes.
experience
Yes.
while preparing for this exam? How what was your strategy? How you started basically? It'll be really
How did
interesting.
I start? So at
Yeah.
first, yeah, so I first did something as DEM, which is Diploma in Emergency Medicine. It's a small kind of a certificate course that's given by the Royal College of, I think not medicine, but some hospital in the UK sponsors that.
Mm-hmm.
It's a very small course. I did that first for a year, and then you can then prepare for something known as MRChem. That's Membership Royal College of Emergency Medicine. So their exams. So they have three exams that you give. So there's the Part A, Part B, and then you have an OSCE exam. At
Mm-hmm.
the end of which you can then get a GMC license, and then you can work in the UK as a middle grade doctor.
Okay. So,
I started
basically,
preparing.
you started preparing. So, in India itself, you gave these steps, or like how was it?
Yeah.
So, can you
No,
just
you can give it in India because India is a center for the exams.
okay? So, can you just give
So,
a brief?
because
I
there's
mean,
how,
right? Can you just in detail? You can just brief about this exam, or how many steps are there, and how to start the preparation from where what is the resources? Is there any medical official website for it or something like
yeah,
that?
yeah. So the MRChem Part A, which is now renamed as FRChem Primary SBA exam,
Mm-hmm.
is it contains things like basic sciences, so your anatomy, your physiology, stuff like that.
Mm-hmm.
There is a FRChem primary website. So if you go to Google and just type FRChem preparatory courses or FRChem SPA preparatory courses, they'll direct you to this website that has got a lot of questions, an entire question bank. So
Mm-hmm.
to do those questions every day, at least do at least 50 per what we say per thing. So there are like multiple branches or multiple subjects, at
Mm-hmm.
least 50 of per, and then learn whatever you are doing. But that's emergency medicine. So it's the same way. You can either do that or you do MRCP or MRCS, stuff like that. So each college,
Mm-hmm.
each specialty has their college,
Mm-hmm.
which then gives out this exam, and then you can prepare for that online. Yeah.
Right. So, can you just explain a bit what is the difference between this MRCP, MRCS, and then people are into PLABs also, if you can?
Okay, so MR Chem is your emergency specialty. So if you're interested in emergency medicine, you want to you want to further your career in emergency, so you do MR Chem.
Okay.
And then MRCS is for surgery. If you want to further your career into surgery, then you do MRCS. That's Membership Royal College of Surgery. And then MRCP is Membership Royal College of Physicians, which if you give that exam, then you can become a internal medicine. Like that's for internal medicine. Okay.
Mm-hmm. Okay.
That's the thing. So, but each specialty is a little bit different. MR Chem is, I mean, it's easier to get into specialty
Mm-hmm.
because the UK always has very less emergency medicine doctors because it's difficult to retain specialty. So they always have more jobs.
Mm-hmm.
But and then the MRCP is also easier to get into. I mean, as easier to, if you do it and you come, that's a great thing. But if you come as an IMT and then come here, that's another way to do it. So if
Mm-hmm.
you do that, then that's also easy to get into. MRCS, becoming a surgeon, is a bit difficult because they actually like surgeons within on the home ground, but
Mm-hmm.
it's not impossible. I have a friend who is working here as a surgeon, so it's not completely impossible, but it can be a little bit difficult, a little bit tricky. Just to remember that.
Okay.
So all of these things are like a direct specialty. So I do not give PLAB because I give MR Chem.
Okay.
And MR Chem is a specialty exam.
Mm-hmm.
So if I give MR Chem, they can give me a GMC license on that basis, but you need to be licensed in your country. So you
Okay.
need to have an MCI license or like an what we say, an Indian license, working license, to be accepted and get your GMC license here if you go via MR Chem.
Okay.
But PLAB is different. PLAB is where you give the exam, you get your license, and then of course you can work. Yeah.
Okay. So for
But if
PLAB,
you want to do MR Chem, yeah.
mm-hmm. So
Mhm.
for PLABs, I mean, they don't need MCI certification, or they
No, for
need.
PLABs you don't need. No, for PLABs you don't need, because for PLAB you're actually appearing for a licensing exam. So
Mm-hmm.
UK is happy to give you that license. But
Okay.
for MR Chem, you're not actually applying for a licensing exam. You've given these tests. So GMC is happy as long as you're licensed in your own country.
In your own
That's the
country.
thing.
Okay.
Yeah.
So, like in this scenario, like how many steps can be can one give in home country, and for how many which steps? I mean, they need to go to UK and appear for the exam.
So for MR Chem, you and for MRCP and I think MRCS as well, you can give all the initial steps within the country because India is a center for exam. So many people from other countries come to India to give the exam,
Okay.
which is very lucky for. I mean, we are very blessed to be in such a country that they
Yes.
that
Ye-
people come to our country to give the exam.
Yes.
Um, so I gave the first three steps here, but these other, like the final MR Chem is UK based. Yeah.
Okay.
So
So,
after MR Chem, you still have two more
so how
exams
many
to become
steps are
consultant.
there total exactly?
So the total, if you want to work as a middle grade, so
Mm-hmm.
that's as a junior doctor, but not very junior, not like SHO level, so not like intern level.
Mm-hmm.
Then you give the three steps. So that's FR Chem SPA, primary. Then you have the FR Chem, there's the SAQ thing, which is also now replaced with, and then you have your MR Chem OSCE. So
Okay.
are these three, if you give it, then after you come to the UK, you then have to work to be a consultant because the end stage is that to become a boss, isn't it? So
Mm-hmm.
for doing that, you have to give two more exams, but then you also have to do a lot of work in between. So there's different pathways you can choose to become a consultant.
Okay. So, okay. So basically for like what is a financial requirement, if you can give some idea a student should keep in their head, if they want to appear for these exams, what kind of
Yeah.
financial balance they need to have?
Okay. So these exams are quite costly because UK does take a lot of money for the exam. So each exam costs around 300 to 400 pounds.
Mm-hmm.
That's just each exam, each attempt. So you need to focus a lot and work hard so that you can pass that attempt. So each exam is 300 to 400 pounds.
Okay.
Um,
Hello?
yeah, hi.
Yeah, hi.
Yeah. Mhm.
Yeah, can you just come again? I think there was some
Mm.
network issue was there.
Okay. So I said each exam is around 300 to 400 pounds.
Okay.
Yeah,
Yeah,
for
so
each attempt. Yeah.
okay. So like what kind of visa they will require to come to UK for to sit in these exams?
So no, because they happen in India, so
Right.
you don't
All
need
the
to
steps.
come to the UK to give. But if no, so the first three steps. But the
Right.
last two steps, you have to come to UK, and then you do require a visa. If you're not working in the UK, then you do
Huh.
require a visa to come.
So what kind of visa they will be requiring for that?
What kind of visa?
Yeah.
Yes. So I think if you're coming for giving an exam and they know that for the exam purpose, they probably will be happy to give you a tourist visa. If you're coming to work, of course, they'll give you a work permit.
So is it easy to get the work permit of for the like for the UK?
For doctors, it is easy. Yes.
For doctors,
Yeah.
it is easy. If you're working in your
Yes.
own country, it is bit easier. Yeah.
It is a bit easier, yeah, because if you've given the exams, if you're coming there, it is not a problem. It is easy to get it's not easy, but they're happy to give it to you so that you can like come and work in their country because you're coming to work here. So then, it's like an exchange of goods kind of.
Mhm.
Yeah.
So is there any like we have some criteria for the matching of the specialty, right, in USA?
Mhm.
So similarly, do we have certain kind of criterias to just match with the specialty you would like to have?
So I think for that, so what I have done is like you can give these exams and come and work in the UK as a non-trainee grade. If you're going to apply for
Mhm.
training, then they have these certain criteria. So each field has their own list of criterias, which if you go to there's a website known as Health Education England, they'll give you the list that is required for each. So it depends upon which specialty you want to apply to for training,
Mhm.
and it gives you this, and then you can work through that to get those kind of competencies.
Mhm.
If you're in a non-training grade, you can do something known as CSER, so
Mhm.
which is like you get all the kind of documentation and everything on your own, and then all those proofs. But it is a very long process, and it's very tedious, and it is a lot of paperwork. So
Mhm.
most people like to apply for training so that it's like get this fixed kind of thing that you can do, and someone else is responsible to help you with that.
Okay, so do they get paid while this training, or it is
Of course, it will get paid. No, no, no. It is paid. Yeah,
okay? So
of course.
approximately
Yeah.
how much they can
Mhm.
expect?
It depends on your years of practice, but I think if you are joining as a non-training grade, like as I am currently,
Mhm.
so at present I earn around 67 per annum, so 67,000 per annum.
Mhm.
And then there are colleagues who earn more than me because they've been, so I did this field 4 years before coming, so my pay grade is not that much. But then there are people who've had 10 years of experience or more, so their pay grade is much higher than me. So you can expect around 60, 70. If you're working outside London, then the pay is more. If you're working within London, the pay is a little bit less because everyone wants to train in London.
Mhm.
Um, and yeah, so that's the pay grade. And if you join training, then it might go down a little bit, but it's still a protected pay scale.
Okay. So we can say, right, once you get into this training program, you can at least be financially independent. You can just finance yourself, right?
Can. Yes, yes, you can be financially independent.
Right.
Yes.
And
Mhm.
do they need any kind of block account or something to like what kind of other requirements they ask for? Like, any block accounts they need to see or about the, financial backgrounds or financial secure as a financial security.
So if you're applying for tourist visa, they might ask you all of that. But if you're applying to work there, but the work visa basically depends on a sponsorship. So you give your interview and then there you get a job. And
Mhm.
then the hospital sponsors you to come. This is letting the government know that the hospital is going to take care of you, in the sense the
Okay.
hospital is going to pay you a salary that will help you live in this country and then pay for certain things like all the commodities and everything. So that helps you get the work visa, basically.
Mhm. Okay.
Yeah.
And what is the procedure of, getting these invitations for the interviews?
Oh, so I went through an agent, but you can also go via the NHS website. So I went through an agent and he put out my portfolio to various hospitals, and then hospitals came back to him saying that they would like to set up an interview with me. Similarly, you can also go via at the NHS websites. If you go to NHS website or something, so you can say that you want to apply as a doctor, so you can apply to them directly. So it's an either or
Either or, right.
Yeah.
So, can you just tell us about like what kind of documents do we need from the university and from home country? Are there any particular type of
Um,
documents?
So there are some documents required because when I was giving USMLE, I applied for something known as so they need to vet your forms and everything. So there's an agency that does that. And there's this form called Form 136 that needs to go to the university, get signed by them, and then sent back to them.
Okay.
That took a little time to go back and forth.
Mm-hmm.
I know, I mean, it's difficult, but once that is done, because I studied in Russia, they required a lot more documents from me to be able to give. So they asked me stuff like, in the 6 years, how much time was clinical? How much time did I do like practical things, clinical things? And then within that, they wanted to know the dates of the rotations and also the hospitals where I did those rotations. Yeah,
Oh.
so you need to write all of that down, like sit and recall. So I actually had to sit, and this was like 6 to 8 years after I'd left Russia. So I tried to get my old what we say timetables. You sit and recall where all you went, then go on the website, get the address of your
Mm-hmm.
hospitals where you did your rotations, and then write all of that down. But this all has to be on the letterhead of the university. So I had to send all of this to the university. And then after that, they printed out that on their letterhead, signed it by the rector, and then scanned it back to you. So it was a bit of a long process.
It was
Yeah.
so
So
long.
it needs quite a bit of planning. Yeah. But this is all this paperwork is needed when you apply for your GMC
Mm-hmm.
in this. Yeah.
Okay, so for training, you don't need this. So for giving the first three steps, you don't need this. But when you'll be applying for the GMC, you'll need that,
Yes.
right?
Yes. But the thing is, and for training, you need it as well because you're getting training because you have a license.
You have a
So
license,
this is all for license. GMC provides license to work.
right?
Even when you give PLAB, before you give PLAB, they'll ask for all of this. Yeah.
Right. And do we need any documents from our home country?
Home country, I think the only thing they require would be I don't know. I don't think it's anything. I mean, if you the if you had a bit of a gap between applying to GMC, then they'll want to know what you did during those years. But I
Mhm.
don't think you need anything else from the home country. Yeah. Yeah. It's
Okay,
mostly the
so
med school things that
yeah. Okay, so can
Mhm.
students give these tests while they are, in their college, in their university itself? Can they appear for this?
No, no, I don't think so. I don't think it would be useful
Mhm.
because it's a specialty exam.
Okay.
So if they give it during the college times, which I don't think so, because when you apply for the exam, you need to get vetted by supervisors saying that you are like working in the emergency department, stuff like
Mhm.
that. So
Mhm.
if they've not graduated, they're not actually what we say applicable to give that exam.
Same applies for PLABs as well, right?
Same applies for what?
PLABs.
For PLAB, no, I think PLAB you can. It's because PLAB is like US Emily. So like how you can pass your first part in when you're in second or third year, then fourth part in this year, and then sorry, first part, then you have your second part somewhere in the fourth year, and then by the time you graduate, you can do your third part. So PLAB is like US Emily. So you can give PLAB because PLAB is a licensing exam, but MRChem is different because MRChem is a specialty exam.
Specialty, yes.
Mhm.
So if
Yeah.
students are targeting for PLABs, so you would you suggest these young doctors to actually, apply, prepare for the PLAB and start giving the steps in university time itself, so that they can save time for the
Yeah,
graduation. That would be better,
yes. Yeah, that would be better. That would be very, very, very wise to do.
right? And they can give like right after their third year or second year. I mean, if you have a bit of idea about it.
I I don't have that much idea about PLAB, but I know that PLAB 1 is about all the initial things that we learn. There's anatomy, physiology, biochemistry, and stuff. So you can give it in second year. Then your PLAB 2 is, I think, if you aim it around fourth or fifth year because it's more clinical. Um, and then I think PLAB, no, I think this PLAB has only 2 steps. I don't think it has 3 steps. But then there's an OSCE as well.
Mhm.
There always will be an OSCE. That's where you do the Viva, where you go and actually see the patient and then take history and stuff like that.
Right.
Yeah.
Right. So did you find any difference between like, when you're working or while you were giving the exams and all these, going through with the training and everything? Did you find any difference that you are a FMG and, IMG is having any kind of difference? Indian medical graduates.
Um, okay. So the only advantage I felt they had was that they didn't have to give any exam. So for them, their exit exam was like, oh, you've done MBBS, here's your degree, you can start working. Which I found very funny because I said that every the country doesn't do this. Like, UK, you have to either do PLAB, or you have to, even when you apply for internship, you
Uh-huh.
have to apply to a place to get the internship. So it's not that easy that you just walk into places. And even USA does the same thing. You have to give USMLE. Australia does the same thing. So
Mhm.
I just feel that they were like, oh, we're an IMG, we're better than you. And I'm like, are you really? Because I had to I had to jump through many other hoops to like get my license. So just chill a little bit. That was the only, yeah.
Like a boss, always. Yes. So,
Yeah,
okay. Yeah.
yeah.
So tell me one thing, why this branch?
Why emergency medicine? So I got interested, like I was always a bit interested towards emergency medicine because I liked how it's got a lot of variety, a lot of spectrum,
Mhm.
and you can have like someone who is dying, at the same time someone who has a very small thing, and someone who like comes in with something else, but then you find out, oh, there's something else going on with this person.
Mhm.
So that's why, and it's very dynamic field, like it's like there's a lot to do and a lot to keep in mind.
Mhm.
So in fourth year medicine, I was interested in that. Then somehow I was like, okay, probably let me just try some other fields. And
Mhm.
then when I did my internship is when I was like, no, I like this field. Yeah,
Yeah.
I didn't want to do any other field that much as I like
Yeah.
the emergency medicine. So I was like, I
Right.
think I'm made for this field. Mm.
You got a match.
I got a match. Yes,
You got
yes.
a match.
That is true. This is the match that really matters. Rest of the matches don't really matter. So this was the match that really mattered.
Agree. 110% agree on it. Right. So as
I
we
yeah.
as we discussed earlier about the salary, and when, I mean, FMGs do have this thing in their mind that, if they're choosing this path, so, when they're going to get the financial stability and everything. So we have discussed, okay, this kind of, if they are under training during the training program itself, they can be financially stable. Right. So along with it, what kind of other benefits
Yeah.
they will be getting, like in UK?
Hmm. For the training program, or other benefits, like just benefits?
Benefits like, like insurance, and some allowances, and
Okay. So you actually, for now, we need to, like, no, if you are on a work visa, you have to pay for your insurance.
Mhm,
But yeah, and NHS is accessible to you. And also if your parents come over, I think NHS is accessible to them too. I don't think that, I mean, that's why they're a little bit discouraging of getting your parents over, because they're like they're worried about the NHS being overused by
mhm,
immigrant parents,
mhm,
which I understand. And then it adds a lot to your practice.
mhm,
Working with in the NHS, working with the consultants here, working with your colleagues here, and the nurses and the EDAs, it actually adds a lot to your practice. You become a very wholesome, different person.
mhm.
Um, there was not much. So I do love my country, but I could not work there as a doctor. And at some point, I could feel that there's something dissociating with what my values are, what I want, and what is being given to me. Just to say that there are people who love working in India, even doctors or in IT and other fields, but it was not my place to work. And when I came to the UK, I felt it quite a bit good fit, and it added a lot to my practice. It added a lot to how I took decisions. It made me a more confident doctor, even with my procedures and stuff like that. On night shifts, like you are on your own on a night shift, you don't have consultants. I
Mhm.
mean, they're there on the phone if you need them, but otherwise you are on your own. So the place to work to
Mhm.
experience that.